As I begin this presentation on skin cancer, I convey a message of clarity and careful understanding. In today's narrative, I intend to illuminate the importance of recognizing and addressing skin cancer, a critical health concern that impacts countless individuals across diverse communities. My explanation is rooted in factual details and reflective observations drawn from both medical research and everyday experiences. The subject at hand is not merely a medical condition but a phenomenon that intertwines lifestyle choices, environmental exposure, and genetic predispositions in a delicate balance. In this narrative, I will explore the multifaceted nature of skin cancer, emphasizing why it demands careful attention even for those who lead relatively healthy lives. My approach is grounded in precision, ensuring that every detail is presented in a manner that is both understandable and respectful of the gravity of the subject. As you follow along, you will find that the narrative is structured in a logical progression, from defining and understanding the various forms of skin cancer to identifying the risk factors, detection methods, and treatment options available. This introduction sets the stage for an in-depth exploration, ensuring that the knowledge shared is comprehensive and directly applicable to everyday life, ultimately fostering informed decisions regarding skin health. In examining the nature of skin cancer, I detail the various types that are clinically recognized and their respective impacts on health. The most well-known among these is melanoma, a form that originates in the pigment-producing melanocytes and is infamous for its aggressive nature if not detected promptly. Alongside melanoma, there are basal cell carcinoma and squamous cell carcinoma, each of which presents distinct characteristics and degrees of risk. Basal cell carcinoma, although the most common, generally grows slowly and is less likely to metastasize, while squamous cell carcinoma, emerging from the skin's squamous cells, poses a greater risk of spreading if left untreated. In this narrative, I describe not only the biological differences between these types but also the nuances of how they affect patients over time. The impact of these conditions is underscored by the personal and societal challenges they present, from the psychological burden of a cancer diagnosis to the physical disfigurement that may follow treatment. I illustrate these points with reflective insights into how early detection can ameliorate harsh outcomes, emphasizing the role of awareness in reducing severe impacts. Through a balanced discussion that intertwines clinical definitions with the human experience, I underscore the importance of understanding the complete picture of skin cancer, thereby laying a foundation for both prevention and informed medical decision-making. Delving deeper into the narrative, I explore the risk factors that contribute to the development of skin cancer. With a focus on the interplay between lifestyle and genetic predispositions, the role of ultraviolet (UV) radiation is central to this discussion. Daily exposure to the sun, particularly during peak hours, significantly increases the risk of damaging the skin cells, a phenomenon that may eventually lead to cancerous mutations. Through a methodical examination, I describe how consistent sun exposure without proper protective measures, such as the use of sunscreen or wearing protective clothing, accumulates over time. Equally important is the genetic aspect, where a family history of skin cancer or certain genetic markers can predispose individuals to increased vulnerability. I convey the narrative by recalling scenarios of individuals who enjoyed leisurely days at the beach, unaware that the cumulative exposure could have long-term repercussions. Moreover, I emphasize that environmental dynamics, such as living in regions with high UV indices, compound these risks. By presenting these factors in a straightforward and factual manner, the narrative distinguishes between avoidable behaviors and inherent genetic risks, thereby equipping the audience with a clear understanding. This balanced perspective fosters a sense of responsibility in the audience, encouraging proactive measures that can mitigate these risk factors, ultimately leading to a more informed approach to personal health and well-being. In this comprehensive segment, I focus on detection methods and the critical importance of early identification of skin cancer. The narrative unfolds by illustrating systematic self-examinations as a first line of defense. I describe in detail the methodical process of performing a self-exam, using a well-lit mirror to carefully survey all parts of the body, paying particular attention to areas that are often neglected, such as the back, scalp, and regions behind the ears. I explain that it is essential to observe any new or changing moles, spots, or lesions on the skin. I introduce the ABCDE framework: asymmetry, border irregularities, color variations, diameter of the lesion, and evolution or changes over time, which provides a structured approach for identifying suspicious marks. This framework is integrated into the narrative as an easily remembered guide to empower individuals with the ability to spot abnormalities early. Transitioning to the role of medical professionals, I outline the importance of scheduled dermatological examinations. Here, I describe a scenario where a patient's routine checkup leads to an early diagnosis, underscoring how professional intervention often confirms and strengthens personal observations. With a clear emphasis on the collaborative nature of effective detection, the narrative explains the tools dermatologists use, including dermoscopy, a technique that provides magnified imagery of the skin, and biopsies that definitively determine whether cells are cancerous. I detail how these methods, while technical in execution, are seamlessly integrated into standard preventive healthcare practice. The narrative also discusses the emotional and psychological benefits of early detection. It is presented not only as a clinical imperative but also as a cornerstone of proactive healthcare. By providing concrete examples of both self-diagnosis and professional evaluation, I emphasize that informed vigilance can significantly improve treatment outcomes. This section is a call for regular self-assessment in tandem with scheduled medical reviews. The narrative concludes by relating the profound impact that early diagnosis can have on survival rates, thereby reinforcing the message that careful observation and timely medical consultation are vital to managing and overcoming skin cancer. It is a testament to the power of knowledge and routine care in preserving health and mitigating the risks associated with skin cancer. Transitioning into a discussion on treatment options, I outline a range of methods available for addressing skin cancer once detected. The narrative delineates both non-invasive and invasive therapies with clarity. Non-invasive treatments include topical medications and radiation therapy, which serve as initial measures for less aggressive forms of skin cancer. These methods are carefully explained, emphasizing that they aim not only to target cancerous cells but also to preserve as much of the healthy skin as possible. For more advanced cases, surgical procedures, which may involve removing affected tissue or reconstructing the skin's surface, are described with a focus on precision and controlled application by trained specialists. I present these options in a manner that respects the seriousness of the procedures while also highlighting the progressive advances in medical technology that enhance safety and recovery outcomes. The narrative carefully notes that each treatment option is chosen based on the type and severity of the cancer, as well as the patient's overall health condition. In navigating these choices, the emphasis is placed on a collaborative decision-making process between the patient and a skilled healthcare provider. This approach not only ensures that the treatment is tailored to individual needs but also underscores that hope and recovery are realistic prospects, facilitated by modern medical practices and the continued dedication of the medical community. In closing, I stitch together the threads of the narrative by summarizing the crucial aspects of understanding, detecting, and treating skin cancer. The narrative reaffirms that a thorough knowledge of the various types of skin cancer, coupled with an awareness of risk factors and early symptoms, is the cornerstone of effective prevention and timely care. Emphasizing a culture of vigilance, I stress that routine self-exams, complemented by professional checkups, are essential practices for maintaining optimal skin health. The narrative concludes with a reflection on the empowerment that comes from being informed and proactive. I present a call to action that invites individuals to integrate preventive measures such as proper sun protection, regular monitoring, and prompt medical consultations into their daily lives. This final part of the narrative is crafted to resonate with a broad audience, reinforcing that each person possesses the capability to reduce their own risk of skin cancer. The ultimate message is one of optimism and responsibility, a reminder that by embracing informed self-care and community support, the fight against skin cancer can be approached with confidence and determination.